Hi, my name is Annique Tracy. I am a pelvic floor physical therapist from the University of California, San Diego. And this video is meant for those who are undergoing a robot-assisted laparoscopic prostatectomy and what to expect around pelvic floor physical therapy and how it can help decrease urinary leakage after this type of surgery, which can be quite common. So a little bit about pelvic floor physical therapy. We address the muscles of your pelvic floor or your Kegel muscles, and these muscles line the underside of your pelvis. So here is a pelvic model, and you have 3 different layers of the muscles that attach to the bottom of your pelvis and kind of create a hammock underneath your pelvis and are important in bladder and sexual function. After a prostatectomy, studies have shown that it's important to be able to coordinate and engage these muscles to decrease urinary leakage with exertional movements and actions. For example, coughing, sneezing, standing up from a seated position. Having said that, what to expect is before your surgery, we'll typically see you 1 to 2 times, and those sessions will consist of teaching you how to contract your pelvic floor or perform a Kegel appropriately, and how to coordinate that muscle so that you can be working on strengthening and coordination in the days to weeks leading up to your surgery. We'll also discuss common occurrences that can happen after your surgery. For example, how to manage constipation, swelling, and pain in the perineal or pelvic area. And then after your prostatectomy, we typically see you within the first week after your catheter is removed. And in those sessions, we'll focus once again on the pelvic floor muscles or Kegel muscles to help regain urinary continence after the procedure. And also by working on these muscles, they're also important in sexual function, and erectile dysfunction can be quite common after a prostatectomy. And we'll typically use biofeedback, at least initially. And it's a machine that we use in order to have you visualize what your pelvic floor muscles are doing in real time, and can be really helpful in learning how to contract your pelvic floor and work on the strength and coordination of that muscle group. We will also work on slowly progressing you to your goals to get back to without urinary leakage. And that can be sport, lifting, or even running. And so we'll gradually work towards meeting those goals with decreased amount of leakage of urine. So studies have shown that rehabilitation or pelvic floor physical therapy can be really helpful in mitigating the duration and severity of urinary leakage after a prostatectomy compared to those who have not had pelvic floor physical therapy. And I hope this video answered some questions or concerns that might have come up regarding what we do and why pelvic floor physical therapy is an important part of the rehabilitation process after a prostatectomy. Thank you for listening.